We're rolling. Yeah.
Hi, everybody.
Hello.
Hi.
Welcome to Ladies of the Lanai. I'm Christine.
I'm Tina.
And we're out on Tina's Lanai. And we're here today with our special guest once again, Rebecca Brewer. Why don't you introduce yourself and tell everyone what you do?
My name is Rebecca Brewer. I live here in the Villages as well. And I help people with their health insurance, and I specialize in Medicare. I'm an independent agent broker, which means I represent most all of the companies, and that way I can help you do what's right for you.
Great. And how long have you been doing this kind of work?
20 to 25 years.
Wow. So you know.
Yes, I love it.
Okay. So you help people with their selections with their health insurance, specifically Medicare, but also other commercial insurance as well, but mostly Medicare, right?
Correct.
And so what are some of the downfalls of others trying to navigate health insurance decisions on their own?
Just not knowing what they don't know. You know, I always say you don't know what you don't know. And there's no reason to do it on your own and be confused when you have somebody like me who knows the ins and outs and can, you know, show you all your options and then direct you whatever is going to work for you based on your medications, your health, the specialties you need, your chronic conditions and whatnot. So there's no reason not to use somebody. It doesn't cost you anything more to use an agent, and I don't charge anything for my services.
I think that's usually a big question people have.
Yeah,
is
what do you?
How much is it? How you know?
It's going to cost me extra somehow, some way. It's going to cost me extra to use someone like you.
And it's not, if you go directly to the carrier, you're going to pay the same. So it doesn't matter which, how you do it, but it's better to have an advocate that's looking out for you and that can help you all the time.
And I actually reached out to you because I'm not eligible for Medicare yet, but my insurance with my previous employer runs out the end of this year, and I'm all confused because I don't know where to go or what to do with, like you said, considering any medications I take or the doctors that I use.
Right.
And you're going to help me go through that process.
Yes, I am.
So, okay.
So how exactly do you help villagers navigate the system?
Well, I work at a couple of the Villages Health Care Centers. I don't work for the Villages Health. We just have offices there. So I kind of know ins and outs of how the Villages Health works. And so a lot of times I'll invite them over to one of my offices, give them a tour of the Villages Health, see if that's an option for them, if they want to use that. That's like a concierge service. It's very easy to use. And then we go from there, see what they have, what kind of plan they're looking for, and explain the differences between all the different types of plans, and then help them find doctors if they don't want to use Villages Health.
Okay. And what are some of the differences between Medigap and Medicare Advantage plans? What is Medigap? I'm not familiar since I'm not in Medicare yet.
So when you first turn 65, you enroll in Medicare, which is the Medicare A and B. A for hospitals and B for doctors and outpatient services. A is no charge if you've worked your 40 quarters, and B is a charge, and that covers the doctors, and they take that directly out of your social if you're taking it. If not, they send you a monthly statement. And then you use original Medicare, and then you get on a Medigap to pick up what Medicare doesn't cover, and then you get a standalone drug plan. And but you don't get any extras with that plan, like you don't get any dental or vision or hearing. Medicare covers diseases of the eye and one pair of glasses after cataract surgery, and that's it.
Oh.
So, and Medicare Advantage plans, you're no longer using the red, white, and blue card. You're using whatever insurance company we sign you up for, and that's kind of like takes the place of all three of those.
Okay. So would if I'm someone who's approaching the age of Medicare, because isn't there kind of like a look back period, and are there things you should do to prep before you become Medicare, and is that something that you could help people with, or something you would?
I mean, the first thing you need to do is 3 months before you're going to turn 65 is sign up for your Medicare A and B. And then once you do that, then we review all your options, and then get you enrolled so that by the time you're 65, you already have your cards and you're in place and you're all set to go. Because Medicare actually starts the first day of the month of your birth month.
Okay.
So
if I'm June 9th, it starts June 1st.
correct.
Okay. And so would I come to you like at 64 and a half and say, hey, I'm getting ready, or at 64?
Well, normally when people do that, I just tell them the first thing you need to do is enroll in Medicare. Once you get your Medicare card, call me.
Okay.
And we'll go over your options.
Okay. And one of the reasons why we wanted to do this follow-up video, because we did a previous one with you, was you mentioned there's a lot of really important changes coming up in 2025 for Medicare. So do you want to tell us all the fun,
Yes.
the fun that's coming for people and what they need to do and the deadlines and
Okay.
all of that?
So Medicare
And we
open
also have Barky von Schnauzer.
Yeah, sorry if you
next
hear a
door.
dog in the background.
This is the joy of taping on the Lanai.
Yeah.
First of all, Medicare Part B premium for 2025 is going to be $185. And so that's going to go up about, $10 from where it is right now. $174.70 is what it currently is. And the Part B deductible for 2025 is going to be $240. And that's mainly for people that are on the Medigap plans. They pay their Part B premium before Medicare starts paying anything for them. So that's the first thing that I wanted to say. Also, I'm sure you all know this. If you're on Medicare, you're going to get a 2.5% cost of living adjustment. That's the smallest adjustment we've had since 2021.
And what does that mean exactly?
Well, you just take whatever amount that you're currently getting and you times 2.5%.
So it means I get more.
You get an increase.
Of my coverage or my pay?
Your payment, your premium. I mean, what you
I
get
pay-
back.
Oh, okay.
Your Social Security check.
Okay.
You're not taking that yet. You're too young.
I'm getting close.
The spring chicken over there. The other big change has to do with the Inflation Reduction Act, and that's coming into place in 2025, and that's what's causing the stir with the biggest disruption we've ever had in Medicare. So the Inflation Reduction Act, what it does is it pertains to the drugs. They're taking away the donut hole and just making a maximum out of pocket. So $2,000 is the maximum out of pocket for your drugs for 2025.
Can you explain what a donut hole is for those of us that don't?
Well, the donut hole was originally like the insurance company paid their portion and you paid your co-pays. And once you reached a certain dollar amount, you were in the donut hole. And then you had to pay a percentage, which could be quite expensive, until you reached $8,000 of your own money.
Wow.
Once you reached $8,000, then you went into catastrophic and you didn't owe anything else. But so now it's going to be a $2,000 max. So there's two kinds of drug plans, and whether you go on a standalone drug plan or you're on a Medicare Advantage, there's a basic alternative plan, and then there's a enhanced alternative plan. And depending on the plan is how your drug costs are going to affect you. So it's important to have somebody look at your drugs. The formularies are changing. They're narrowing down on certain plans. They're taking drugs out of formularies. So it can be very restrictive. So it's imperative that you check your drugs this year, no matter what type of plan you're on.
And again, that's something you could help them if
Yes.
someone has a list of their drugs.
Yes.
They come to you and you can review it with them.
Absolutely.
And does it matter if they're generic drugs or name brand or?
I mean, a lot of times people were on generics and they switched them into a tier 3. So it depends on the generic. If you're on basic generics that you were paying $0 for, it's probably not going to affect you. But what happened is they put 80% of the cost of the drugs after 2000 on the insurance companies. And that's why they've had to adjust the benefits so that they can sustain themselves through this. They're responsible for 80% of the cost of the drugs after 2000. And that's a big burden.
And so can you remind us, what are the deadlines? What needs to be done by what time this year?
So to change a standalone drug plan, it's October 15th through December 7th. Okay. And that's also for Medicare Advantage plans. However, a Medicare Advantage plans does have one more enrollment period from January 1st to March 31st. They can make a change if we, so they get 2 chances to change. But if you're on a standalone drug plan, the only thing you can do after December 7th is go back to original Medicare. Like if you're on a Advantage plan and you don't like it, you can change to another Advantage plan, and you can go back to original Medicare and a standalone drug plan. So
it's all very confusing, and I'm not even on Medicare.
it is.
Yeah, I don't know why they make it more confusing.
I know, as you get older.
Yeah.
Yes, and this new thing about how to figure out the drugs also, you know, a lot of times I'm able to, even though they have a $2,000 max out of pocket, a lot of times I can help them save $500 or $600 just by picking the right plan.
Okay. So, and if I'm on Medicare and all these deadlines you're talking about, and I'm all confused, I can just call you up and say, I don't know, do I need to do anything?
Right.
You can just.
Yeah, we can just have a phone consultation. You don't have
Okay.
to see me in person
Okay,
at
that's
all.
good.
You can ask me the questions and I can see how I can help you over the phone and move on from there. And then if we need to have a face-to-face appointment, we can.
Okay.
And for those of you who are listening and you want to find out how to contact Rebecca, in the description of the video, we'll put your phone number and how people can contact you.
Okay.
Mm-hmm.
And what about the Village's health? Are there changes if people are in that system that they need to be aware of for next year?
It's staying status quo for this year. You know, they basically only take Medicare Advantage plans. They do take commercial plans. You have to be a certain age to use Village's Health.
How old is that?
I've been told it's 62. If you have a husband or a wife who's on Medicare and you have commercial, they'll take you as long as you're 61, 62. I can get you in. But yeah, they only take Medicare Advantage, Florida Blue, United Healthcare, and some Humana.
Yeah, I remember when I first came here, I was under the age, and my husband was Medicare age, and they took me because I guess they assume I'm going to swoop in with
Right.
him.
Your package deal?
Yeah,
Yeah.
eventually, even though not in that moment. Yeah.
Right. That's the way they work it.
Yeah.
And so with Eastport opening up, are there changes happening with the Village's Health? Or updates or
They're getting
things are moving around or?
They're getting a new care center over there, and it's going to open in January. That's confirmed. The new care center will open in January. So for people that are moving over to Eastport, you're going to have your own care center.
And that's something that would I have to wait till January? Can you give tours now, or you have to wait till January? If somebody wants to take a tour there, you can arrange for that?
Yeah, what we're doing now is Lake Deaton would be the closest care center to Eastport. So we get them a tour, have them pick out a doctor. Then once January comes, we do the transfer of care over to Eastport Care Center, and they can choose a different doctor over there if they choose.
Okay.
So even mid premium year, you can switch.
Yes, you can.
And switch it, get a new primary.
Yes, you can. Anytime you don't like your doctor, I'll be happy to help you switch your provider.
Good. Because sometimes I feel like I'm just talking to a phone bank when my doctor's at a unnamed conglomerate.
Right.
And I can't get the doctor's office. When I call, it's like a call center, and it's like, I just want to talk to my doctor, someone in the office.
Right.
And just whatever it is.
Right.
So there's frustration sometimes. So that would be good if you can help
Yes.
give recommendations of what other patients or clients have enjoyed.
What I found, because I use the Village's Health just like you do, I find it very convenient to go to the patient portal and send my question or my request through that, because Village's Health, each doctor has a team of 4. So they have a primary care, a nurse practitioner, and 2 medical assistants.
Good.
So the doctor and the nurse practitioner are really busy, right? And so the medical assistants are reading the stuff that comes in, and then in between patients, they're asking the doctors and sending the refills over, or sending the referral to a specialist, or doing whatever your request was.
And you find that they're very responsive?
Oh my gosh, within 2 hours.
Because let me tell you, the same unnamed place
Uh-oh.
I send through the app, because they're like, oh, use the app. and I'll send a message, nothing. 3 days later, I'll go, does anybody read these?
Oh no.
I send another, nothing. And then maybe a week later, or if I go in for an appointment, they're like, oh, we were blah, blah, blah. Like, to know in 2 hours, or at least within 24 hours or
Right.
12 hours, that someone would respond.
Yeah, and I'm sure we
is
have two
good.
different doctors, and
Right.
I will say I get the same. I'll say within 24 hours I got to answer for sure, 100% of the time.
Right. And, Villages Health is like a concierge service. They spend 90 minutes with you on your first appointment, and then 30 to 60 minutes on your follow-ups, and you can get same-day appointments, if you're sick. They have a clinic over in Sumter Landing at Creekside where they have Saturday and Sunday appointments. They're available to you 24 hours, 7 days a week. You get your blood work there, you get x-rays there. It's just, you don't even wait more than 5 minutes, and
It sounds like one-stop shopping.
it is. It's very easy.
You know what I like the best about it is traditionally, when you go to the doctor and they'd say, okay, now you need to go to a dermatologist, or you need to go to the OBGYN, or you need to go to, get this test or that test. They'll give you some numbers maybe, and you're on your own trying to find who's got an appointment and how to schedule it and when it is, and and hearing, oh, sorry, we don't take new patients, or
Right.
we don't take that.
Oh,
That
yeah.
doesn't happen with the Villages, what Rebecca is referring to as the concierge service. They tell you, okay, we need all these things, you'll get some calls. And you do.
Oh,
You
they
get-
call you.
They
Yes.
call you, so it's already nailed down that they're available, that they take your insurance, and that they take what you're needing.
Right.
They can handle it.
Because
And they-
And then you can
They-
spend so much time making those calls.
And they communicate with each other too through the computer. So whenever you see a specialist or an outside doctor, they send the notes over to your primary care doctor and all the test results of anything they did. So that's really, really important, because that is, like patient care. You want your doctors talking to each other,
Right.
because you want to know what the other one's doing.
Yeah.
Um,
The whole medical record thing, the whole
Right.
electronic medical record thing. Sometimes, traditionally you'd have to be responsible for asking this doctor, could you please send it to that doctor?
Right.
Yeah.
And, oh, we did already. And, oh, did you get the fax? It's always like clunky. It's supposed to be seamless, but I will say that I have found in the Villages system that it is seamless. Everything does go up to your record.
And the biggest thing is as people age and they get, their health deteriorates and they're seeing lots of doctors, their children cannot keep up with all these doctors and the communication. So to know that everything goes back to their primary, and their children could just talk to the primary care doctor and get all the notes, is incredible, and it's very helpful.
Is that something you could help someone that they realize they're aging, or they have a lot of health issues, and I want to involve my child or children, and maybe you could help them and say, this is kind of how you should involve them, and these are the things you should have them authorized for?
Right.
Is that something you could do, or?
It's, we can help them, get the forms, so that if they want to call Medicare, if they want to call the carrier, they're listed as, kind of like a POA.
Right, but maybe there's like a little checklist. Make sure there you have for Medicare, make sure you have for the primary, make sure you
Right.
have for blah blah blah, like those kind of things. They know your list of medications.
Right. And when I help somebody, I help people in many other states as well. So,
What states are you? I want to say registered. What do you say?
well,
Is it
I'm
registered?
licensed.
Licensed. Okay, that's the word.
License.
So Georgia, South Carolina, North Carolina, Alabama, Tennessee, Michigan, Ohio,
Florida.
Florida. Well, of course, Florida.
And
That's
that
right.
helps for people who are snowbirds?
Yes. So what I do is a lot of times I try to get them on a national plan that they can use here and use there. However, to get on a Florida plan, you have to be a resident of Florida. Otherwise, I have to sign you up on a plan that's in your home state. Wherever you're, say, your primary resident, wherever you're filing your taxes, that's your resident state. Unless you're going to file your taxes here, you're not a resident here.
Okay. And now we have someone yelling across the street. And then what about, I think you had mentioned there was something special for veterans this year. Is that only for United Healthcare?
No, Humana has something United has something and Florida Blue has something. However, United has the biggest give back. So if you're on TRICARE for Life or Champ VA and you're using Original Medicare, we have a plan where you can get $100 back monthly into your Social Security check, a reduction. And that's just very nice. And then you get the extra benefits, and then you're able to use the Village's Health. You don't pay any co-pays.
That
Because
could cover a lot of medications, or $100 a month.
right, but they get their medications through the VA, through their system.
I'm just
So
meaning like to get $100, like
Yeah,
you
I
know.
think I think if you had said before, if they're getting their medications through the original VA, then that's how they get there.
right, then this plan would work for them. I have
Yeah.
other plans that have drug plans with it if they're not getting them through the VA, but if you're Champ VA or TRICARE for Life, they don't want it. They don't want to be on a plan with drugs because it doesn't coordinate. So
Okay. And then before, I think we mentioned, like, do you do anything with dental or no? Because a lot of plans don't cover dental.
yeah, all the Medicare Advantage plans cover dental, but if you're on commercial or you're on a Medigap plan, they don't come with dental, and I have standalone dental, vision, and hearing plans.
Okay. But that's something you can help people with.
Yes,
too.
I can.
Okay. Are there any other important updates? Deadlines?
December 7th, and don't wait till the last day.
Okay, 'cause you'll be busy.
Yes, I'll probably be up till midnight.
You're
geez.
like an accountant on April 15th.
Yes, exactly.
All right.
Exactly. So if you get a notice that your plan is changing, just reach out to, if you have an agent you're working with, continue to work with them. If I can help you here in the Villages or surrounding area, or if I'm in your state and you would like me to help you, I'd be glad to do it.
So if people get notices they don't understand, can
Right.
they call you and say, hey, I got this, I don't know what it means?
Right. And I have them read it to me, and then sometimes I have them take a picture of it and text it to me, and then I can tell them exactly what it is.
Okay.
Okay.
Yeah. I try to break it down. When I'm helping elderly people, I'll say, are your kids involved in your care? Can we do a 3-way call with
Oh, that's
them?
great.
So I really like them to be on the phone so they can hear everything,
Yeah.
because it's a lot to digest.
It is. Even when you're, like for me, just hearing all about Medicare, I'm like, oh my God, I don't know if I can do this.
It's a lot. They definitely make it more complicated. I don't know why.
Oh.
It's crazy. But anyway, I guess that's it for now. So thanks so much for watching. We really appreciate it. Don't forget to like and subscribe. And like we said earlier, if you're interested in getting in touch with Rebecca, we'll put her phone number and her information in the description of the video. Maybe you just want to say it right now for those who have trouble finding what we're talking about.
Okay.
Yeah.
My phone number is 803-614-8330, and my email is Reb, Brewer, Brewer, @gmail.com.
Great. And again, thanks again for listening. And Tina and I hope you really appreciate, the passion and the work that we do to bring great guests on for you. So, and when we see new people liking and subscribing and commenting,
It makes us happy.
yeah, it does. It really does.
Makes me happy too.
All right.
Thank you.
Bye for now.
Okay.
Bye. Thanks for
Bye.
inviting
We'll see
me,
you on
ladies.
Lanai.
Yeah.